Assalamu alaikum, students. Today we will discuss the MCQs regarding the male reproductive system. So, the spermatic cord and its contents. The spermatic cord suspends the testes and contains all of the following except. So, spermatic cord contains the testicular artery, testicular veins, deferens duct, and lymphatics. So, ureter is not the component of the spermatic cord. Spermatic cord extends from the abdomen into the scrotum through the femoral canal, obturator foramen, perineum, inguinal canal, rectus sheath. So it extends from the abdominal wall into the scrotum through the inguinal canal. The spermatic cord attaches to which part of the testes? So anterior surface, medial surface, posterior wall, inferior border, superior pole. So it attaches to the posterior wall. Which of the following tissues forms the covering sheath of the spermatic cord? So it is covered by a cartilage, bone, stratified epithelium, smooth muscle, connective tissue, fibrous tissue, and skeletal muscle only. So it is covered by smooth muscle, connective, and fibrous tissue. Now, regarding the blood supply and venous drainage of the testes, the testicular artery arises directly from the abdominal aorta. So, the testicular arteries are branches of the abdominal aorta. Left testicular vein drains into. Now, the left testicular vein, it has a different drainage than the right testicular vein. So, it drains into the left renal vein, while the right testicular vein drains directly into the inferior vena cava. The right testicular vein drains directly into the inferior vena cava. Now, lymphatics and neural pathways to testes. Lymph from the testes drains into the para-aortic lumbar lymph nodes. So, it does not drain into the superficial inguinal lymph nodes. It drains into the lymph nodes along the aorta in the abdomen. So, lymphatics goes into the abdomen through the spermatic cord and the anterior abdominal wall into the abdomen. Testicular nerve arises from which spinal levels? So it arises from the T10 to T11. Ductus deferens. Ductus deferens or vas deferens is approximately how much lengthy? How much length? 45 centimeters. The seminal vesicles are located anterior to the bladder, below the prostate, on the posterior aspect of the bladder, inside the urethra, within the scrotum. So they are located on the posterior aspect of the bladder. The length of seminal vesicle is approximately how many? It's approximately, I think, 5 centimeter long. Let me confirm the other ones also. Okay. So it's the length of the seminal vesicle is the 5 centimeter. It is 5 centimeter long. So the epithelial lining of the seminal vesicle is composed of columnar epithelium. Duct of each seminal vesicle joins the different duct to form the duct of each seminal vesicle joins the different duct. Sorry, it was not different duct, the vast or the vast deferens to form the prostatic duct, ejaculatory duct, vas deferens, urethra, ureter. So its the correct answer is the ejaculatory duct. Now the seminal fluid contributes approximately what percentage of the semen volume? So it is about seminal fluid contributes about the 60%. Which of the following component is found in seminal fluid and provides energy for the sperm? So correct answer is the fructose, which is a carbohydrate and it provides energy for the sperms. Why is seminal fluid alkaline? To dissolve the cervical mucus, to maintain osmotic balance, to protect sperm from acidic vaginal secretions, to neutralize urine in the urethra, to stimulate uterine contractions. So, seminal fluid is alkaline because the secretions in the vagina, they are acidic. And to protect the sperm, and its function is to protect the sperm from the acidic vaginal secretions. Each ejaculatory duct is formed by the union of, now we know that the duct of the seminal vesicle and ductus deferens जो है, it makes up the ejaculatory ducts. Where do the ejaculatory ducts open? Now, where do the ejaculatory ducts open? They open into the bladder, into the penile urethra, into the rectum, into the prostatic urethra, in the seminal vesicle. So they open up into the prostatic urethra. Now, the prostate gland contributes approximately what percentage of semen volume? So it's about prostate gland, it about contributes about, I think, 30%. The function of the clotting enzyme in the prostatic fluid is to prevent fertilization, reduce acidity in vagina, thicken semen to retain it near the cervix, increase urine flow, prevent coagulation. So the function of the clotting enzyme in the prostatic fluid is to thicken the semen to retain it near the cervix. Then we have the urethra structure and pathway. Total length of male urethra is approximately 19 to 20 centimeters. Now the part of the urethra that passes through the prostate is called the, of course, it is called the prostatic urethra. The shortest and narrowest part of the male urethra is the membranous urethra. The penile urethra runs through which structure? Corpus spongiosum. The internal urethral sphincter is made up of smooth muscles. So it is an involuntary sphincter. The external urethral sphincter surrounds which part of the urethra? External urethral sphincter. It surrounds the external urethral orifice, membranous urethra. It surrounds the external urethral membranous urethra. I think it surrounds the membranous urethra. The external urethral sphincter consists of External urethral sphincter consists of skeletal muscles. Which structure anchors the penis in the perineum? Its root anchor the penis in the perineum. Why many cylindrical masses of How many cylindrical masses of erectile tissues are found in the penis? 1, 2, 3, 4, 5. So it's 3. 2 corpora cavernosa and 1 corpus spongiosum. The corpus spongiosum is distinguished by which of the following features? So it contains urethra. That's why it is distinguished. Which arteries supply the blood to the penis? So deep dorsal and bulbar branches of the internal pudendal artery supplies the penis. What physiological mechanism leads to penile erection? Dilatation of arterioles and vasoconstriction. So arterioles are dilated and veins are constricted so that the blood stays there and there is penile erection. Thank you so much.